So in the news, it is suggesting that the government are thinking about giving some people a third vaccination, so they are fully immune. This would be given to people who have a weak immune system, people who are vulnerable, um, people who face medical issues such as advanced HIV, such as blood cancer, such as problems faced during organ transplant. People who have a weak immune system. And personally, I think giving them another jab is a positive thing because these people would be fully immune and have a stronger immune, would have a much more, would have a less chances of catching the virus. Um, I think that vaccination is helping a lot. The number of cases before the vaccine were much higher, and the vaccine is helping a lot. And I think with the vaccine being given at such a high rate, being given at such a high number daily, I think that it should take a couple of months before everything should be back to normal. It should take, but on the other hand, I still think it might take a couple of years since the whole virus has disappeared. But I think the vaccine is helping a lot. Um, there's also debates about whether vaccination should be given to 12 to 15-year-olds in the UK because there's a very less likely chance that these teenagers would get the virus because they are much more healthier. There's little chance that they will get the vaccine, so there is a debate within the government that whether 12 to 15-year-olds should be given the vaccine. Some countries such as France, Italy, and Canada have also agreed to give 12 to 15-year-olds the vaccines. Personally, I think that it depends. It depends on the teenager because some teenagers might also have a weak immune system. It really depends on the teenager. Some teenagers might actually need the virus. But I also agree that teenagers, especially from 12 to 15, are very healthy, and there's a very less likely chance that they'll be affected with the virus. But